Hello everyone, this is Ivy again, the dietitian on the bariatric team at TWH Bariatric Surgery Clinic. Now we're going to be reviewing the vitamin mineral supplement module for post-bariatric surgery. Now, initially, everyone was on a chewable vitamin and mineral supplement. This is because chewables are easier to get down in the first month post-surgery. However, at this point, we're asking people to switch to pill forms of supplements to continue for life. The pill forms may be easier to find, cheaper, and better absorbed. Let's start with the multivitamin. Remember, the dose of the multivitamin is 2 per day. Make sure you're taking a multivitamin with at least 18 milligrams of iron. If you just started on a new bottle and unfortunately does not have 18 milligrams, then you can consider adding a separate iron supplement. You can send us a message if you need help finding a right iron supplement. You would have received a multivitamin handout with a list of multivitamin products we found to meet the guidelines. So you can use this to help you make an appropriate purchase. Some examples are listed on the slides here. Next is the calcium with vitamin D supplements. The total dosing you need is 1,200 to 1,500 milligrams of calcium citrate. Calcium citrate is the preferred form for optimum absorption post-surgery. The tricky thing with calcium is that your body can only absorb about 500 to 600 milligrams at a time. So you need to spread out the doses of calcium throughout the day. You have also received a handout containing calcium citrate with vitamin D products that meet the guidelines. So use that to help you choose the appropriate option. Some examples are listed on the slide. Dosing is going to depend on which supplement you're taking because they all contain different amounts. The most popular one is the Weber's Natural Calcium Citrate, often found at Costco. Since these pills are only 300 milligrams each, this means that we'll need 4 per day to meet our needs of 1,200 milligrams. Since our body cannot absorb it all at once, we'll need to take 2 pills twice per day, each dose separated from one another by at least 2 hours, also at least 2 hours away from your multivitamin, as the iron in the multivitamin can interfere with calcium absorption, so it's important that we space them out. Also important to know that if you're a postmenopausal woman, your needs are higher. There we should aim for 1,500 milligrams a day. Lastly, let's review the vitamin B12. You will need to take 500 micrograms of B12 per day. Previously, we had you on a chewable or dissolvable B12 dosed at 1,000 micrograms. This is still okay to take, but make sure we're taking it every other day. Some people do an injection once a month. That's okay as well. You want to be careful with B12 that are extended release or timed release. This will be indicated by a clock icon on the supplement bottle. This will not be a good option for you because it takes more stomach acid and stay in the stomach longer before it is absorbed further down the intestinal tract. But we want things to be more easily absorbed by your system since it is now producing less stomach acid and fewer enzymes post-surgery. So avoid the extended release or time release vitamin B12 supplements. Now let's take a look at an example of what the supplement schedule may look like. Many patients choose to take their 2 multivitamins and that 1 B12 every other day at breakfast time. Then at lunch and at dinner, they take their calcium with vitamin D. With the Bariatric Advantage Calcium Citrate Chewy Bites, you will need to take it 3 times a day rather than 2 times a day. So you take one at lunch, one at snack, and one at dinner. This can be a lot of information. It can seem very overwhelming at first. You may find it beneficial to get a pill organizer to help you keep track or set an alarm or timer on your phone to remind you to take your supplements regularly. Also, we're here to support you. If you have any specific questions about which supplements to use, what dosage, when to take it, please message your dietitian for clarification. This is the end of this module. I'll see you in the next one.